Welcome to Podocyte Talk. In this episode, we explore three important studies that address significant aspects of care for patients with chronic kidney disease: vascular access patency, blood transfusion strategies, and the burden of pruritus in dialysis patients. The first study examined the effects of hemodiafiltration compared to hemodialysis on maintaining vascular access functionality in patients starting dialysis. Hemodiafiltration reduces inflammation and oxidative stress, which are key contributors to vascular access stenosis. This multicenter prospective study followed 612 patients who underwent vascular access procedures and began dialysis. Over 24 months, patients receiving hemodiafiltration had a significantly higher vascular access patency rate, with 74% retaining functional access compared to 48% in those on hemodialysis. The benefits of hemodiafiltration were consistent across various subgroups, including older individuals, men, and those with diabetes, cardiovascular disease, low hemoglobin, or low albumin levels. The use of hemodiafiltration and statins was associated with improved outcomes, while a history of cardiovascular disease or poorly controlled diabetes increased the risk of vascular access failure. These findings suggest that hemodiafiltration may provide better long-term outcomes for vascular access in high-risk populations. The second study focused on blood transfusion strategies in patients with myocardial infarction and chronic kidney disease. Chronic kidney disease is commonly associated with anemia and an increased risk of myocardial infarction, yet the optimal transfusion strategy in these patients is uncertain. This study analyzed over 3,500 myocardial infarction patients, including more than 2,200 with chronic kidney disease, to compare liberal and restrictive transfusion thresholds. A liberal transfusion strategy involved transfusing at a hemoglobin level below 10 grams per deciliter, while a restrictive strategy involved transfusing at a level of 7 to 8 grams per deciliter. Among patients with advanced chronic kidney disease who were not on dialysis, the restrictive strategy was associated with a higher risk of death or recurrent myocardial infarction within 30 days compared to the liberal approach. In patients with moderate chronic kidney disease and those on dialysis, there were no significant differences between the two strategies. These results suggest that a liberal transfusion strategy may be safer and associated with less harm for non-dialysis dependent patients with advanced chronic kidney disease. The third study investigated pruritus, a common but often under-recognized symptom in patients receiving dialysis. The study included 3,281 patients receiving maintenance dialysis in Stockholm, Sweden, between 2005 and 2021. At baseline, 14% of patients reported pruritus, and an additional 19% developed it during follow-up. The presence of pruritus was associated with older age, female sex, lower serum albumin levels, and higher levels of inflammatory markers, calcium and phosphorus. Patients with pruritus had an increased risk of sleep disorders, anxiety, depression, and severe infections such as sepsis and peritonitis. However, no link was found between pruritus and an increased risk of death from any cause. The findings highlight the significant burden of pruritus in dialysis patients, with 1/3 of patients experiencing this symptom during their first years of treatment and its association with adverse health outcomes. These studies shed light on critical issues in the management of chronic kidney disease, emphasizing the benefits of hemodiafiltration for vascular access patency, the importance of transfusion strategies tailored to cardiac risk, and the need to address pruritus to improve patient well-being. Join us on Podocyte Talk as we discuss these important findings and their implications for advancing care in chronic kidney disease. Stay tuned for more discussions on innovative research and treatment approaches in nephrology.